The dentist and her patient, feeling she couldn't treat. Lesbian love. The storm rolled over the quiet town of Cedar Heights the same morning Claire Morgan realized her life was about to change. She didn't know how or why, but something inside her felt restless, trembling like a loose instrument on a dental tray. It was early, the clouds were low, and the first patient of the day would arrive in 20 minutes. Yet her hands kept shaking as if preparing for an unexpected impact, something deeper than routine, something that wouldn't fit into the sterile light of her clinic. She stood in her office doorway, unaware that within an hour she would meet someone whose smile would haunt her heart more deeply than any she had ever been trained to treat. If you believe in kindness, healing, and second chances, please like, comment, share, and subscribe to the channel. It truly helps the stories reach more hearts. The bell above the clinic door chimed softly, delicate and uncertain, and Claire looked up to see a woman hesitantly stepping inside. Her name, according to the appointment schedule, was Hannah Collins, a 29-year-old graphic designer who had recently moved from Ohio to the suburbs of Cedar Heights, California. She was dressed simply: jeans, a soft navy hoodie, and a crossbody bag, but there was something gentle yet quietly heavy in the way she moved. Her deep brown hair fell in light, uneven waves as though she had cut it herself during a difficult night, and her hazel eyes carried a tiredness that felt more emotional than physical. Claire greeted her with the warmth she offered all patients, but the moment their eyes met, something in her chest tightened, an unfamiliar contraction she couldn't diagnose. As Hannah settled into the dental chair, Claire prepared her tools, forcing her focus back to professionalism. Yet she couldn't ignore the way Hannah's gaze lingered on the ceiling, as if the world up there mattered more than anything happening to her. She seemed the kind of person who was both present and far away at the same time. When Claire leaned in to examine her, Hannah instinctively tensed, almost flinching, and Claire stopped, letting her voice soften in a way she rarely allowed. She explained every step with gentle reassurance, noticing how Hannah slowly relaxed, inch by inch, until her breath steadied. It was such a small thing, but for reasons Claire couldn't name, it felt like watching a wounded bird trust a human hand. Throughout the examination, Claire learned Hannah had neglected her dental care for years due to overwhelming anxiety and a past experience with a dismissive, rough dentist. Claire listened, deeply, feeling a surprising ache at the thought of someone being handled carelessly in a place meant for healing. She found herself speaking more softly, moving more slowly, offering calm presence rather than clinical detachment. Hannah's gratitude was immediate and sincere, her eyes warming with relief every time Claire paused to ensure she was okay. Something changed in the room then, not romantic, not yet, but unmistakably intimate in the emotional sense. It felt like two stories brushing against each other for the first time. Cautiously, curiously, after the appointment, Hannah lingered at the reception desk. She smiled shyly, an expression Claire realized she wanted to see again, and scheduled her next visit. When she left, the door chimed softly again, but this time it sounded like the beginning of something rather than an ending. Over the next few weeks, Hannah became a regular at the clinic. Her treatments required multiple sessions, but Claire sensed Hannah sometimes scheduled extra cleanings or check-ins simply for the comfort of being in a place where she felt seen and safe. And though Claire tried to pretend it was all routine, she felt the warmth of something blooming quietly inside her. She wasn't inexperienced with love, but she had long buried that part of her identity to protect herself in a conservative environment. Her feelings were always something she kept tucked away, tidy, quiet, manageable. That was easier. Safer, but nothing about Hannah felt tidy or quiet or manageable. With every visit, Hannah opened up more about her difficult relocation, her loneliness in a new city, her struggles with anxiety after her last relationship, where her partner had dismissed her fears as too much work. Claire listened like she was absorbing each word into her bloodstream. She offered gentle encouragement, never pushing, never prying. She simply held space for her. And yet, even in those calm conversations, Claire felt something stirring that frightened her. She wasn't supposed to fall for someone she treated. She wasn't supposed to feel drawn to a patient. There were lines, professional boundaries, rules. But her heart didn't care for rules, it cared for the softness in Hannah's eyes when she laughed, the quiet strength she carried despite everything, the courage it took for her to show up even when she was afraid. One late afternoon appointment changed everything. Hannah arrived soaked from the unexpected California rain, her hair damp, her hoodie clinging to her like a second skin. Claire ushered her in quickly, handing her a towel with a concern that felt far too personal. As Hannah dried her hair, she looked up and said something that made Claire's heartbeat falter. She admitted she had almost cancelled, not because of fear, but because she didn't want to seem too attached to the place, and to Claire masked her reaction with a slow breath. but inside, something cracked open. She tried to proceed with the appointment, but her hands trembled slightly, betraying her calm exterior. The clinic seemed too quiet, the lights too bright, and the beating of her own heart too loud. She kept telling herself she was imagining things, that she was reading into kindness, into comfort, into connection. But then, when Hannah's hand brushed hers by accident, Hannah didn't pull away. She lingered, breathing softly, as if waiting to see if Claire would move first, but Claire didn't. She couldn't. Her fear held her in place, fear of stepping over a line, fear of risking her career, fear of losing something she didn't even have yet, fear of wanting. So she stepped back, gently and professionally, even as her chest tightened painfully. Over the next few days, Claire found herself more distracted than she had been in years. She reviewed dental charts with half a mind, replaying the near touch of Hannah's hand. She spent hours thinking about things she shouldn't, what Hannah's laugh sounded like in moments of pure joy, how her shoulders relaxed when she felt safe, how she looked at Claire with a softness that felt almost like a secret being shared. Claire knew she needed to stay professional, yet every instinct told her this connection was not something she could simply deny away. Then, one evening, after the clinic had closed, Claire received a message. It was from Hannah. It was polite, hesitant, and deeply vulnerable. Hannah thanked her for making her feel safe, for treating her with kindness she wasn't used to. She said that every visit helped her feel a little more whole. And then she wrote one last line that Claire read over and over again. I hope I'm not crossing a boundary, but sometimes I feel like you're treating more than just my teeth. The words hit Claire harder than she expected. She sat at her desk, phone in hand, heart pounding in a way that felt terrifying and alive. She wrote back carefully, saying she valued Hannah's trust deeply but needed to maintain clear boundaries while she was still her patient. It was true, and it was safe, but it felt like cutting a piece of her own heart away. Hannah responded with understanding and grace, but Claire sensed the disappointment hidden beneath the words. The next appointment was quiet. Professional. Almost painfully polite, but something new existed between them now, an unspoken truth humming like a secret current, impossible to ignore. Claire knew she had to face it. She also knew that once Hannah's treatment was completed, the boundary would no longer be the same. She found herself counting the days not with relief, but with fear of losing the connection, fear of stopping before things could even begin. The final appointment arrived faster than Claire wanted. As Hannah sat in the chair for the last time, she smiled sadly, as though acknowledging an ending neither of them wanted. When it was over, Claire walked her to the door. The clinic felt different, quiet in a way that felt like goodbye. Hannah thanked her again, her voice warm but heavy, and Claire knew that if she let her leave now, she would regret it for the rest of her life. She took a breath. Then another. Her heart felt loud and unsteady, and for the first time, she let courage win. She told Hannah that if she ever wanted to talk outside the clinic as friends, without the professional barrier, she would like that. She made sure her voice was calm, steady, unmistakably genuine. Hannah's eyes widened, hope flickering to life like a candle after a long night. She agreed. Softly. Earnestly. And then she stepped closer and hugged Claire, a long, grateful embrace that felt like healing itself. For that night, they met for coffee. A week later, they met again, and slowly, beautifully, something began to grow, not rushed, not forced, but steady and honest. For the first time in years, Claire didn't feel afraid of who she was or what she felt. If this story touched your heart, please like, comment, share, and subscribe. It truly helps keep these emotional stories alive. Before the ending, please comment below. Everyone deserves a love that heals. Months passed, and their connection deepened in its own gentle rhythm. Hannah continued her healing, not just with her smile but with her heart, and Claire found herself opening up in ways she had never allowed before.